And if you look at the word addiction, there's typically a negative stigma to it.
Sure.
So we really try to emphasize that people are struggling with a substance use disorder. It is a DSM-5 diagnosis that they're struggling with. When you hear addiction, the community typically associates that with negative consequences, crime, that stigma that's going to be permeated. So we try to refer to individuals with a substance use disorder.
Hello, everyone, and welcome to Mindful Moods and Mental Grooves, an educational wellness experience focusing on mental health and well-being. On this episode, I am joined by Becky June and Eric Pollock from the Robinson Counseling Center Substance Use Disorder Program in Wilkes-Barre, Pennsylvania. Becky, this is actually the first time, by the way, that I've had not one but two people on the podcast at the same time, which I feel is awesome. So this is actually a first for the podcast. But just to introduce you both, Becky is in long-term recovery, has worked in the SUD field for 10 years, and is a certified recovery specialist since 2017. Becky has been at the Robinson Counseling Center since 2022 and has been working in the CRS department specifically with Luzerne County Community Warm Handoff Program. She works with individuals who are experiencing a substance-induced emergency and assists them with any current barriers or needs to admit into appropriate level of care. Eric is the director of the Substance Use Disorder Program and is certified alcohol and drug counselor. He's been in the field for 8 years and currently provides oversight of SUD clinical programs, prevention programs, and certified recovery specialist programs. Guys, thank you so much for joining me. I appreciate that.
Thanks for having us.
So the first question that I would like to ask is because, I don't really know. So I have a two-part question for you guys. First question is there a difference between substance abuse and substance use?
They're typically used interchangeably, abuse and use. But if you're looking at the difference between abuse and dependency, that's where you're going to find a significant difference.
Piggyback off of that question, is there a difference between addiction versus a substance use disorder?
You want that one, Becky, or you want me to take it?
Well, I think when we're speaking in terms of addiction, we're talking about something that's current, something that's actively happening.
Sure.
And then when we're talking about substance abuse disorder, I mean, I can say that I don't believe that anybody is ever cured from addiction or from substance use disorder, but I believe that they just aren't integrated anymore with the disease of addiction.
And if you look at the word addiction, there's typically a negative stigma to it.
Sure.
So we really try to emphasize that people are struggling with a substance use disorder. It is a DSM-5 diagnosis that they're struggling with. When you hear addiction, the community typically associates that with negative consequences, crime, that stigma that's going to be permeated. So we try to refer to individuals with a substance use disorder.
Excellent.
Historically, when we first started here, we were called the Drug and Alcohol Program.
Right.
We're now the SUD program, Substance Use Disorder Program.
Excellent. So there definitely has been that stigma, I think, is what kind of has changed it for you guys.
Absolutely.
Mm-hmm.
Yeah, that's great. I guess this is a question for both of you guys, and feel free, maybe ladies first, to answer. Why is helping treat substance use important to you guys personally?
For me personally, as you had said earlier, I'm a person in long-term recovery. If somebody would have asked me 12 years ago if I would have landed working in substance use disorder, my answer would have been a dead no. But in becoming a person in long-term recovery, I'm extremely grateful for the people that were there for me, especially in my earlier years. So I just continue to give back what people did for me. So that's why it matters most to me, is just continuing to be somebody that's there for people that are coming in new.
Eric?
Yeah, for me, I had no ambition to be in the SUD field when I first started. I needed an internship, had an internship at a local outpatient substance use disorder facility, and fell in love with it 8 years ago. From there, I was able to see the outcomes and all the services that are provided to people. And over the course of the last 8 years, being able to see that there's still gaps and being motivated to try to fill those gaps with quality services and continuing to see patients and the outcomes that they're coming into our center with, and where they were at 4 years ago compared to where they're at now, where they're at last month compared to where they're at now. So that constant reinforcement of the positive outcomes we're seeing.
Seeing that success is probably like just tenfold, just, like a positive thing for you guys.
And also
That's
continuing
awesome.
to advocate. A lot of people don't have an advocate.
Absolutely.
So continuing to be that voice, continuing to be that person that's out there saying, we need to enhance this, we need to do this better, we need to continue to add this program.
So, due to stigma, addiction has historically been treated as a crime rather than a disease. Do you guys approach addiction as a health issue rather than a criminal issue?
It's 100% a health issue. If you look at, again, the DSM-5, it's a DSM-5 diagnosis. So each individual, there's a reason why they're coming in the door with a substance use disorder. Our job as therapists are to start exploring some of the reasons why. No one woke up one day and said that I want to use heroin. Things happened throughout their life that led them to use heroin. We're going to look at some of those underlying traumas. We've learned historically arresting our way out of a epidemic such as the one we're in now with opiates isn't possible. We need to treat a substance use disorder continuously as a what was the term you were using? A health condition.
Yeah. Now, do you think that there is a stigma from your guys' perspective that it is treated as more of a criminal issue? Obviously, from your guys' perspective, you are looking at it from more of a mental health perspective, but do you think that there is that stigma that is saying this is more of a criminal issue? People are just picking up and doing these things and they're getting themselves in trouble and that's on them?
So yes, in a way, because you still see the comments that are out there
Sure.
regarding addiction and substance use disorder. You still hear how, I'll use a vague term of law enforcement, as to how some law enforcement reacts with people in active substance use or in recovery. But I've seen progress over the course of the last 8 years too, with law enforcement reducing that stigma. The work's not done, and we're still going to be addressing stigma reduction, but there are improvements. But does it still exist? Yeah.
Yeah, and that's just for me from the outside looking in. I would think that stigma is definitely more turned towards the criminal aspect versus the health aspect. So I like that you guys obviously look at it differently, because I think it's your approach and the way that you treat it is what is helping the clients that you serve, of course.
I think the language that's used, when we change the language that's used, it takes a lot of the stigma away from it. But when you say criminal, that's a stigmatic word. But when
Yeah.
I'm working with an individual, I'm more prone to say legal barriers rather than criminal history.
Okay.
Because when we change the wording, it takes away a lot of that fear that's in place. When they know that I'm not here to judge them and point fingers, then they're more willing to open up and work with me.
I think it's the way, and that's a great example, just like how you approach it and just that quick wording. It still means the same thing, but to them, it can mean a whole world of difference.
Absolutely.
And they might want to be a little more open and more approachable for you guys to assist with care with for them. That's awesome.
Why I like having both myself and Becky June in here. I have the administrative piece of it, but Becky is the peer. She is actively working with people on a
Boots
day
on
in,
the ground,
day
if you
out.
will.
Like
you
she
know?
knows exactly what people are experiencing. She knows the barriers we're running into. She knows some of the stigmas that people are continuing to see.
Do you think that someone's substance use disorder goes hand in hand with their mental health?
It's the question as well.
Or is that too broad of a question?
What came first, the chicken or the egg?
Exactly.
Right. Okay.
So, can a mental health disorder be developed because an ongoing untreated substance use disorder? Yes.
Okay.
And vice versa. Can a substance use disorder be developed because a ongoing undertreated mental health disorder? Yes. If you look at a substance use disorder, there's going to be a multitude of reasons why we developed a substance use disorder. Go back to the earlier statement that no one, when they're born, said, I want to grow up and struggle with this.
Sure.
What are those things that happen throughout their lifetime that led to this result?
Do you guys find it swaying one way or the other, or is it just kind of flip a coin, patient by patient, client by client type of?
I think that when people are saying substance use disorder, they're looking at it like the problem is the using drugs or drinking alcohol, and that's the problem. And in reality, that's the solution. You know, the stopping using drugs and alcohol is the easy part. Now change. You know, so when we're looking at it from that way, there's some underlying issues, oftentimes brought in by trauma from their childhood, that they need to work through with a therapist. So there are mental health issues there that whether they were developed before substance use was picked up or, after the trauma had already happened. I mean, I think that the part where change has to come in, that's the underlying issue, that's where it has to be worked out with a mental health therapist. So I can see that it goes hand in hand.
Sure.
Yeah. And the piggyback off what Becky just said, she made a great point, is that the substance use is the outcome. Is what people don't understand is they like getting high. People enjoy getting high. There's a reason why when you're first starting to use substances, it's enjoyable. You are getting a great euphoric feeling from it. So now we need to stop the bleeding, start sobriety, and then work through some of those issues that led to the substance use itself.
Becky, back to something you said. Do you find a strong relationship between the childhood exposure to abuse and neglect with the substance use?
Absolutely.
Yeah.
I mean, more times than not, when I'm with a client and we're starting to get deep into the issues and why they're looking to get into treatment and why they started using a substance, a lot of times it will come out that there was some type of childhood trauma.
If a person's mental health has declined, let's just say they were doing really well, their mental health starts to decline. Do you think that adds to their addiction or their disorder?
So yeah, if someone is, we'll use two examples. If someone's in active substance use or in sobriety, if there are reasons within their life as to why their mental health is continuing to decline, if they're sober, going to present with a higher risk of relapse. We need to really start addressing some of these issues as to why things are declining. Or if you're in active substance use, yes, your mental health is going to continue to decline where it's going to become a very emergent situation. We need to intervene sooner rather than later.
And
That makes
even
sense.
if they're on mental health medication and they are continuing to use substances, neither of them are working correctly. Like they're going against each other many times where it comes out in poor mental health behaviors. And then we look at the issue of barriers to treatment. And not that they can't find treatment, there's so many barriers that come into place. If the person is homeless, we're looking at transportation. Can they get to the appointment? They haven't eaten all day. They haven't been able to shower. They don't have clean clothes.
Right.
So, I mean, just getting to the mental health appointment to continue to work through these things can be very challenging.
I can only imagine. What about clients that maybe are on medication for their mental health treatment? Does that have adverse side effects or doesn't help maybe the medication that they're taking if they're also abusing drugs or alcohol? Does it enhance it? Does it just kind of diminish it?
I think the hardest thing to do is if you're actively using a substance is we don't know what your baseline is.
Sure.
What's your average? How do you don't know how to feel. So if you're actively using, you expressing what your day in, day out feelings are is going to be broad. It's going to be unmanageable. So it's not going to paint a great picture for us as therapists or our physicians until we remove the substance. We don't know if the med's going to be working or not if you're actively using because your thoughts are going to be different.
Do you guys think that there is a right way versus a wrong way to attack an addiction or a disorder?
I believe that I'm a big promoter of multiple pathways to recovery. No two individuals are the same with how they find sobriety. And I can't put expectations out there for people to get sober the exact way that I got sober. I'm setting them up for failure.
What works for one might not work for the other.
Exactly. I think as soon as people start respecting other people's definition of recovery, we can start to take a stigma out of this addiction.
Absolutely. Do you think that there is really just like, here is one way that you shouldn't be doing it? Or like you're saying, every path is different? Like, can you think of like one thing that's like, oh no, we probably shouldn't be even trying that, doing that?
Not necessarily. I mean, you're going to come into roadblocks along the way.
Sure.
But no one likes being told what to do.
Of course.
As soon as you tell someone what to do, and myself, I'm guilty of it as well. As soon as you tell someone what to do, you're going to get pushback. Let's hear from you as to how you think you want to get sober. And let's walk with you on this recovery journey and see what we're coming across. And if something's working, we're going to continue that. If something's not working, all right, let's try getting some different advice and trying a different path at this time. But early on, we want the patient's full feedback as to what is it that they want to do.
Do you ever find times like when working with a patient early on where you're just like, whoa, that is not a good idea or not a good option?
Oh, every day.
Okay.
Every day. But that's part of the disease, though,
Sure.
is, they're going to see things the way they want to see them, and that's okay. We're going to try your way, and hopefully part of your way is going to work. And if we have to adjust and fine tune as we're going throughout this treatment process, we're more than happy to. But if there's not buy-in from someone struggling with what they need to do, we're not going to make any progress.
Do you find it being a learning process for not only the client, but for you guys as well?
Yeah, easily. We learn something new every day, I say.
What do you think are some challenges that prevent people from seeking help?
I think there's many barriers out there. That's a big part of what the warm handoff program does, is assisting them with eliminating barriers. But I mean, the food insecurity, the housing insecurity, the employment issues that come along with active substance use disorder, all of those things are barriers to people reaching out for help. And a big part of that is the stigma as well. Many of these people that walk into our office aren't walking in there for the first time or walking into a facility for the first time. So there's a lot of shame and guilt that goes along with that as well. And trust is probably one of the biggest barriers, is breaking down that wall that's put up so that they can begin to trust you, so that you can help them get to and find their definition of recovery.
Yeah, I think my first initial thoughts from the outside looking in would be a trust issue. That's definitely. Absolutely. Now you mentioned the warm handoff program. Is that kind of what you guys do in the warm handoff program? Kind of the little things that you mentioned there, or could you maybe elaborate just a little bit on what the warm handoff program is?
Yes, it's the Luzerne County Community Warm Handoff Program, and it's me and another certified recovery specialist, and we're community based, and that's what makes us a little bit different, because we can meet people where they're at. Mentally, spiritually, physically. We've been out in the homeless encampments. We've been in people's homes. We've met people at other agencies in hospital settings to start to figure out what they want and where they want to go. So a lot of the barriers that come into play, right from the beginning, are typically and food insecurity. So we've started a food pantry over at our SUD building
Beautiful.
Not just to help that individuals, but a lot of times they don't want to go into treatment because they know that their families are going to be struggling with some of those insecurities as well. So we try and support the family member while the individual is in treatment. So that's just like the beginning barriers. But once they get out of treatment, some of the barriers that come into play are they can't find employment because they don't have any identifying documentation. So we'll assist them with getting a photo ID, birth certificate, social security card so that they can go out and find a job and help to support their families on their own.
Do you find that being difficult to help, clients get that stuff? Because that sounds like it'd be like a hard thing to do.
No, that's probably a really quick process.
Really?
I mean, Pennsylvania
wow.
does have some really amazing grants in place so that we can assist them with if they have a history of opiate use, they're allowed to get a free copy of their birth certificate.
Oh, okay.
So if a person is experiencing homelessness, they are allowed to get a copy of their photo ID from the DMV. So, I mean, we've also had a lot of people be generous and donations being made just from outside 12-step organizations where we're able to take some of that money and pay for the ID if it's available.
That's fantastic. Now, is that just a Pennsylvania thing, or is it state by state that differs?
State by state is different because we've had individuals that have been born in Florida, born in other states. So, that has been a barrier with obtaining a birth certificate from other states. We did have an individual that was able to get funding to go right to the Philadelphia to get a copy of their birth certificate from North Carolina, and they came back with it in their hand.
That's great.
We just can't go to Philadelphia with these individuals to access that. But if it's other states, it can create barriers.
Well, shout out to Pennsylvania for making things easy.
Absolutely.
Oh my gosh, that's great. I actually did not know that information.
And in an hour last week, I helped an individual gain all 3 of his needed documentations.
Wow.
Yeah.
That's amazing.
Yes.
Oh my gosh. Hey, shout out to Pennsylvania.
Yeah.
What kind of advice could you give to someone who has a family member with an addiction or a disorder?
Love from a distance. That's a good starting point. Is we understand that your family member's struggling, and me as a family member would feel as though I have all the answers. Sometimes you don't have all the answers. You need to take that step back, reach out for help, and let professionals start navigating what your loved one does need. At a point in time, you'll be able to sit down with your loved one and when things start working in therapy and have family therapy sessions. But early on, have that love from a distance, encourage them, be supportive to an extent, but make sure that that doesn't impact your own well being as well. Make sure it's not having a significant impact on your own mental health. Make sure it's not having a significant impact on your own livelihood. But always have professionals reach out for help.
That's a great answer. Now, on the flip side of that, do you find that sometimes family members are the barrier?
It can be.
Can be.
Can be.
Yeah.
Like one of the first things that I try and communicate with family members is in the nicest way possible.
Sure. Of course.
saying,
Always professional.
Let the help help.
Right.
And I know that they've been used to be playing a role in this individual's life of having to be the fixer of so many things, but having a professional there to kind of guide that the individual seeking help, let the help help.
I
and
think that
then-
also kind of plays back to the stigma too of
Sure.
from people on the outside looking in, like,
Right.
oh, you could just stop this right now and you'd be fine. And for some family members, that
Right.
very old school way of thinking, I guess, that's why I asked
Yeah,
because
we wish there was a magic wand and
Right.
we could go have a different career path. That would be
Sure.
phenomenal. And the reality is there's not. And there's going to be a long process in recovery.
absolutely.
Right.
Yeah.
And then, there's also emotions involved with family members.
Oh gosh,
And
yeah.
So I try and, guide them towards, be mad at the disease, not the person. The individual that you love is in there. And the goal here is to get them back. But right now, the disease and the behaviors of the disease is what's up front.
So we talked about a family member, but what about somebody themselves who is struggling but doesn't know where to turn for help? I mean, obviously, for those that are listening or maybe those that are going to be watching, they might not be right in the backyard, Wilkes-Barre, Pennsylvania, have the ability. But what about those that are struggling? Any advice for them?
So if we're looking nationwide, the first thing I would say is go on Google and type in recovery help. Type in Pennsylvania Department of Drug and Alcohol Programs. And there's a plethora of resources out there online where you could get a phone number and that could be the first phone call you make is to your state and they could point you in the right direction as to where to access treatment. If we're looking in Luzerne County, you're welcome to call us, or we have a county oversight called Luzerne, Wyoming County, SCA, and they're a phone call away and they have a slew of contracted providers, us, inpatient facilities, other outpatient facilities, and they could be that central hub and they could point you in the direction that's going to meet the needs that you have.
The last question I want to ask is there anything that you wish people understood better about substance use disorders? I feel like I'm going to get good answers from both of you guys.
There is a solution, and it's not a one size fits all, but you have to start somewhere. Just reaching out for help could start breaking down some of those barriers and those trust issues to lead to the next step to get the level of care needed that will best meet your needs. But starting somewhere is the key thing.
And we don't know when the time is going to be. You could have been through treatment 20 times. Who am I to say that the 21st time isn't going to work? Maybe something's going to change. Maybe you're going to talk to that one therapist that's making a difference, meet that one peer who's going to make a difference, change your environment. So don't stop trying. It could be 20, 30, 40 times. Just keep going. It's our job to make sure we're meeting people where they're at because we don't know when it's going to work.
I think it once again falls back to the stigma. You know what I mean? That stigma. And I feel like every podcast that I've done so far, I think it just turns back around to that stigma, the stigma of mental health, the stigma of substance use, addiction. There's just that outside looking in perception that, isn't really reality. And I think it's people like you guys that help make a difference to kind of flip that around to help people understand better. And I really appreciate you guys coming to share your thoughts and your opinions and the great conversation that we just had. I appreciate you guys. Thank you guys so much for coming.
Thank you for having
Awesome.
us.
Thank you.
Hey guys, thanks for watching. If you like this video, make sure to hit the thumbs up and don't forget to subscribe.